In this video, we will be discussing the proper procedure and technique for medication administration in the classroom. We will begin with the 6 rights of medication administration. The 6 rights of medication administration are right child, right medication, right dose, right route, right time, and right documentation. Make sure that you are providing medication to the correct child. Verify that you are giving the correct medication. Verify the correct amount or dose. Determine the appropriate route, oral, topical, inhalation, or other. Verify that you are giving the medication at the correct time. Document that you gave the medication. If you don't document, it never happened. In this video, we will be addressing the proper procedure before and after administration of oral and topical medications, eye drops, and sunscreen. We will begin with oral medication. Before administering any medication, gather the needed supplies. Then, wash your hands with soap and warm water. Typically, you should wash your hands for a full 20 seconds. This is about the time it takes to sing happy birthday to yourself twice. Next, you need to check the medication administration plan, also called the MAP. You will want to make sure that it is complete, including the child's name, physician, medical problem, medication name, dosage and route, times given, and start and stop date. You will want to know any possible side effects and additional directions for administration. Also verify the parent or guardian's signature and the correct date. You must have a completed map for medication administration. You will then retrieve the medication from the lockbox. All medications, including those belonging to staff and volunteers, must be locked. Once you have the medication out, you will then need to verify the information on the bottle with the information on the map. You should be checking for the correct child's name, correct medication, correct dose, correct route, and expiration date of the medication. Do not administer any medication that has expired. By verifying all of this information, you have already checked for 5 rights of medication administration. The final right documentation, will be completed after medication administration. Now you will measure out the correct dose of medication. Open the bottle and place the lid upside down in order to prevent contamination. Pour the medication at eye level. If using a medication syringe, make sure the medication is drawn to the correct dosage line. Set the medication down and replace the cap on the medication bottle to prevent spills. Now it is time to administer the medication. First, identify the correct child and separate them from the group. Assist the child to drink the medication from a cup or administer the medication through a dropper or mouth syringe. If using a dropper or syringe, position it outside the teeth and against the cheek to prevent the child from spitting out the medication. Make sure the child has actually swallowed the medication before returning them to the group. After giving the medication, return it to the lockbox and wash your hands. Remember to wash your hands for the full 20 seconds. Return to the map to document medication administration. Make sure to document date, time, and dosage given. Then, sign that you gave the medication. You will want to watch for any possible side effects throughout the day and document if they occur. The sixth rite of medication administration, rite documentation, is now complete. If you make a medication error, call poison control immediately, inform the parent or guardian, and report the incident to your supervisor. At the end of the day, communicate to the parent or guardian all medications given and any side effects observed. We will now move on to administration of topical medications. Retrieve the medication from the lockbox and verify the information on the medication with the information on the completed map. After you have confirmed the information, wash your hands. Begin by cleansing the area with soap and warm water where the medication will be applied. For topical medications, you must wear gloves to prevent absorption by your own skin. Once the skin is dry, apply the correct amount of medication to the correct location and rub it into the skin until the medication is absorbed. After administration, remove your gloves, wash your hands, and return the child to the group. Return the medication to the lockbox. Document that you gave the medication and sign the map. Watch for any side effects that may occur. Remember to inform the parent or guardian at the end of the day of all medications given and any side effects. Next, we will discuss administration of eye drops. Retrieve the medication from the lockbox. Compare the information on the eye drops with the information on the map to verify they match. Identify if the medication should be given in both eyes or just one. Then wash your hands. Put on gloves and wipe away any secretions from the inner eye to the outer eye using a sterile gauze pad or cotton ball. Ask the child to look up towards the ceiling. Gently pull down on the child's lower eyelid. Hold the bottle a ½ inch above the child's eye and apply the drops to the inner corner. Ask the child to close their eyes as you apply gentle pressure to the inner eye. Repeat with the second eye if indicated. When you are finished, remove gloves, wash your hands, and return the child to the group. Place the medication back in the lockbox. Document that you administered the medication and sign the map. Observe for any side effects and inform the parent or guardian at the end of the day. We will now review sunscreen protocol. If sunscreen is needed, broad spectrum SPF 30 or greater is required. Sunscreen can only be used on children older than 6 months whose parents have given consent. Each classroom can share one bottle, however, contamination must be avoided. Wash your hands and change gloves between every child. If a parent chooses to provide a bottle of sunscreen, it must be labeled with the child's name and used only on them. Remember the 6 rites of medication administration: right child, right medication, right dose, right route, right time, and right documentation. Before administering any medication, make sure to have an accurate and complete medication administration plan, or MAP, for all medications, and a parental consent for sunscreen. Check to make sure that the medication label matches the MAP information. Check to make sure that the medication has not expired. Do not administer expired medication. Always wash your hands before and after administration of medications. And identify the correct child and separate them from the group. After administering medications, wash your hands. Return the medication to the lockbox. Document on the map that the medication was given. Include the date, time, dosage, side effects, and your signature. observe the child for any possible side effects, and inform the parent or guardian at the end of the day that the medication was given and any possible reactions. Remember, if you make a medication error, call poison control immediately. Inform your supervisor and notify the parent or guardian. All medications, including those belonging to staff and volunteers, must be locked.